Can you repeat it?
Judy.
Oh.
Hi, thank you. I'm Judy Esterquist. I've been a Manhasset resident for over 3 decades. I'm a board member of the New York City chapter of Physicians for a National Health Program. I speak to Section 41A of the town code. I ask it be repealed. This law puts legislators between patients and their healthcare providers, and it threatens them with criminal charges without making anyone safer. It needs to be repealed. It was unscientific government overreach 50 years ago when it criminalized doctors offering abortion care outside hospital-level facilities, which was not New York State law then. It was more restrictive, expensive, and burdensome than medical, quote-unquote, standard of care required then. But it's completely out of date now because, one, it's a violation of New York State law, which covers abortion in its civil code, not in its criminal code. This is a criminal statute, not a civil statute. Two, hospitals were not required in New York State for childbirth 50 years ago, and they are not required now. In fact, 40 years ago, I chose to have my child in a midwife center rather than going to a hospital after spending 3 months trying to figure out what would be safer and better for me. That was not illegal for me. But carrying pregnancy to term is 17 times more dangerous than abortions. New York State government reports from 2022 say that New York State rates 23rd in the U.S. for maternal mortality for childbirth. That's an average of 18 maternal deaths for every 100,000 live births. Abortions have a death rate of 0.7. That is more than a level of magnitude. It's close to 20 times. Less danger than colonoscopies, as we've heard, which are not criminalized if they happen outside of hospitals, which is what this law does. 3, healthcare has changed a great deal in the last 50 years. 50 years ago, abortions required a surgical procedure. They were then, in fact, closer to colonoscopies than they are now. Today, more than half of all abortions are induced by medications. And during the pandemic, many of these were prescribed by telemedicine at the patient's home. They didn't actually even see a doctor other than by video conference. They took the pills at home and they were safe. 2/3 of all abortions, because of these medications, are now before 8 weeks. Requiring patients to go to a hospital or face possible criminal charges to take a pill, which is what this law requires, all patients, even those taking the pill, if they do it at home, are in danger of criminal charges, that is this bill, is against the public interest. It's an unreasonable burden on patients and providers, and quite frankly, it's nuts. So let me summarize. A law that criminalizes abortion violates New York State law. Healthcare should not be in the criminal code. 2, criminalizing abortions that happen outside of hospitals or hospital-type settings puts political interest above medical judgment. Particularly outrageous for care that is safer than childbirth, and childbirth is legal outside hospitals. 3, it's particularly wrong given that more than half of all abortions require swallowing a pill. And then you wait 4 weeks. Our legislators need to leave healthcare decisions to patients and their healthcare providers and get out of criminalizing patients. Please repeal the law. Thank you.
Katie Hangley.
Good evening, and thank you for giving me the opportunity to speak. I want to thank Councilperson Lurvy for proposing the repeal of 41A. She did a wonderful job of explaining what that means, so I won't get into that. We are not here to comment on the legality or morality of abortion. Right now, abortion is legal in New York State, and many of us, myself included, are committed to making sure it stays that way. But tonight's conversation is about Town of North Hempstead Code 41A, which states that an abortion can only be performed in a hospital or a, quote, suitably equipped and staffed facility administered by such hospital or having a hospital affiliation, end quote. Many speakers at last month's meeting and tonight have expressed concern about women's health and stated that an abortion facility with no hospital affiliation is unsafe. These concerns are not based in science or fact. Here are some facts about the risks of abortion to pregnant people. In 2018, the National Academies of Sciences, Engineering, and Medicine undertook a comprehensive review of studies on the safety of abortion methods. In their conclusions, they found, quote, the clinical evidence clearly shows that legal abortions in the United States, whether by medication, aspiration, D&E, or induction, are safe and effective. With regard to 41A, as Dr. Esther Quest did, let's talk about medication abortions. The abortion pill was approved by the FDA in 2020 and is currently approved for use up to 10 weeks gestation. As of 2020, medication abortions account for more than half of all abortions in the United States. This means that more than half of patients can manage their own abortions by taking medications at home. The NASEM study I cited earlier found that the risks of medication abortion are extremely low, with complications, quote, occurring in no more than a fraction of a percent of patients, end quote. 41A, as written, could be interpreted to mean that a person who takes the abortion pill at home could face fines and imprisonment. When we talk about all abortions, including those performed in clinics and doctors' offices, a California study completed in 2015 found that major complications occurred in fewer than 0.25% of first trimester abortions and fewer than 0.5% for abortions performed after the first trimester. And that NASEM study also found that, quote, most abortions can be provided safely in office-based settings, end quote. According to a Guttmacher Institute report on targeted regulation of abortion provider laws, TRAP laws, like 41A, do nothing to enhance the safety of or outcomes for patients. To quote, clinics and providers are required to comply with federal and state safety standards. And another speaker tonight went into great detail about those standards, and I really appreciate that, and I hope that everyone pays attention to that and doesn't state alternative facts this evening. In other words, in the rare case that a patient experiences complications during or after an abortion and the facility does not have the resources on site to manage them, they do what most of us would do in a medical emergency. They call an ambulance. And in a 2015 paper published in the Journal of Obstetrics and Gynecology, one study cited found that 1 out of 5,491 abortion procedures resulted in a patient being transferred to a hospital by ambulance. 1. There is no medical or science-based reason for Code 41A to remain on the books. The risk of death from childbirth is at least 14 times higher than that from abortion, perhaps as high as 20 times, according to a CDC report from 2021. I would suggest that those who are concerned for the health of women and mothers turn their efforts in that direction, rather than to preserving a law that is not justified by facts or science and is clearly intended to limit access to a safe, legal medical procedure. I look forward to a unanimous vote approving the repeal of this law. Thank you for your time.
George A. Doyle. George A. Doyle.